Hi, good evening. I'm Lianne Gensler, a rheumatologist from UCSF in San Francisco, and this is day one of ACR 2020. I'm here to report on spondyloarthritis for the meeting today. There were some fantastic abstracts that were presented that I'm going to review for you today. They all came from oral abstract sessions. Several of them really dealt with treatments in psoriasis and psoriatic arthritis in particular. So the first study that I'm going to talk about is the Maximize trial, and this was abstract number 0505, presented this morning by Xenophon Baraliakos on patients with psoriatic arthritis who have axial involvement, and really thinking about the efficacy of secukinumab on those axial manifestations. Now, these patients were defined as having axial involvement by their investigator. And really thinking about how much disease activity they had by the BASDAI, including patients having a lot of inflammatory back pain. This study really showed that patients had efficacy from an axial standpoint in patients with Caspar criteria psoriatic arthritis. And in fact, they had some MRI data that showed a decrease in the bone marrow edema in the sacroiliac joints and spine compared to placebo, though the confidence intervals were wide, and this was a smaller group of patients. They did not report on peripheral joints, whether they had swelling or tenderness or enthesitis or dactylitis. So it would be fantastic to see those data so that we can prove that this response is really the axial manifestations responding and not just the general psoriatic arthritis getting better, because we know that BASDAI improves in peripheral disease activity too. So, but a very important study and really thinking about this group of patients who have psoriatic arthritis with axial involvement, psoriatic spondylitis, axial PSA. There are lots of ways to think about this and seeing that there may be real efficacy in this particular manifestation of psoriatic arthritis. The next abstract that I'm going to talk about is abstract number 0507. And this was a post-hoc analysis of the EXCEED trial presented by Grace Wright. And this was a trial that was one of the first head-to-head trials of a TNF inhibitor, adalimumab, compared to secukinumab. And what they looked at in this trial is whether there were gender differences in response to treatment. And so they stratified the trial by men and women. And what they noted was that there was a higher treatment response and retention in men compared to women. And interestingly, secukinumab compared to adalimumab had greater efficacy in skin endpoints, but only in men. And so really what this trial is showing us, and I think this is something we've talked about for a while, is that as we think about clinical trials, we should really be stratifying by gender, in that men and women are really different. They respond differently to treatment. And so we should really be thinking about them differently as we approach clinical trials. The third study I'm going to talk about is abstract number 0506, and this was presented by Ian McInnes. It was the 52-week extension trial of the DISCOVER trial with guselkumab and psoriatic arthritis. And what this showed was that there was sustained improvement and maintenance benefits, in particular with radiographic progression, an important endpoint, and also reassuring longer-term safety data. This is always important as we see those long-term extension studies. The last treatment trial I'll mention is abstract 0504, and this was the Eupatacetinib in psoriatic arthritis trial presented by Philip Meese, and this was done in patients that were refractory to biologic DMARDs, really showing good efficacy in the 24-week period, including all core domains. And so that's also important as we think about psoriatic arthritis and really hoping that we don't just improve joints, but also enthesitis and dactylitis and other core domains in psoriatic disease. The final abstract that I'm going to mention was from the second oral presentation session. This was a study looking at the phenotype and genotype predictors of patients that go on to develop psoriatic arthritis. It was presented by Jessie Walsh from the University of Utah. And what she showed, and I'm just going to talk about the phenotypic predictor, was that in patients that had psoriasis, a predictor of going on to develop psoriatic arthritis was really those patients that had nail disease. That's not a new finding, but also really showing that the induration of the plaque, the psoriatic lesion, was a predictor, and in fact, in a dose-related effect. And those patients that had more induration developed psoriatic arthritis earlier. So really thinking about those patients with more severe psoriasis having a much higher risk for going on to develop psoriatic arthritis. This is Lianne Gensler reporting for spondyloarthritis at ACR 2020. For more information, please go back to room now.